and Family Support Services webinar. Of course, my dog hasn't barked all morning and is going to start barking now. I apologize. This webinar is brought to you by Families Helping Families of Southwest Louisiana and LeCan. LeCan is the Louisiana Council's Advocacy Network. I'm your presenter, Melinda Elliott. I'm also the LeCan leader in this area. I cover Beauregard, Allen, Calcasieu, Jeff Davis, and Cameron parishes. Just like the Families Helping Families Center covers those parishes. LeCan is a statewide grassroots advocacy network which links lawmakers, individuals with disabilities, and family members to make positive change in systems serving people with disabilities. LeCan also advocates for policies and systems that support inclusion everywhere people learn, work, live, and play. It advocates for systems that support children and adults with disabilities to live in their own homes and be fully included and participating members of their local schools and community members. LeCan leaders, like myself, provide connection with a regional team of advocates, provide information on proposed policy changes and how those changes affect you and others. There's actually 10 of us across the state. So there's 10 Louisiana Department of Health regions, and there's the 10 LeCan leaders. I think we have a couple of vacancies in a couple of places, but there's space for 10 of us. LeCan leaders provide training and skills to effectively advocate for systems change and support you to link with policymakers. If you'd like to sign up, you're really only signing up to get the emails. Of course, I hope you would do things like contact your policy makers about issues that are in the alert. And some people will even get to the point where they tell their stories in a variety of ways. But the website is www.lecanadvocates, that's all one word with an S, .org. So this year, every year we have a legislative agenda. This year, our legislative agenda covers 3 things. We're working on a $2 an hour rate increase for the providers with a starting pay of $8.65 for the direct support workers. If you have waiver services, that makes a little more sense. And I'll talk a little bit more about waivers at the end, towards the end of this webinar. We're working on a increase for the Families Helping Family Centers. They haven't had an increase in their budget in years, and just like everything else at your house, the price of everything is going up. And the third thing that we've worked on for several years is we have Senator Foyle, who's offering a bill for cameras in the special education classroom. A lot of times our most vulnerable kids are in the special education classrooms. They're nonverbal or they don't have a whole lot of verbal skills. It would be comforting to parents and helpful to educators to have video footage of what goes on in the classroom. And there's a lot of issues that have been worked out around that. But we do have a senator already offering that bill. He's offered it in the past and is again this year. If you're interested, contact me. So a little bit of the agenda today. If you notice, Act 378 is the a bolded large. It's going to be the vast majority of what we talk about today. We're going to talk a little bit about some of the other things on the agenda, and I don't think that this is an exhaustive agenda, but it's just to give you an idea of what we're going to talk about. Although early steps isn't part of Act 378, I like to talk about early steps because it's so important to parents of young children. It is the early intervention in Louisiana. It's called something different in other states for children birth to 3 years old with a developmental disability. The funding stream is actually from the United States Department of Education to our Louisiana Department of Education. In our state, it's not necessarily this way in every state, but in our state, it's administered through the Office for Citizens with Developmental Disabilities, which is actually very helpful because there's a direct connection to the waiver registry or the waiver waiting list, whichever you call it, and those types of services. If you can call, anybody can call to refer a child to early steps for evaluation. That's the number for our area on there. You know, sometimes the paperwork's overwhelming. One of the paperwork pieces of paperwork is if you need other services. We encourage all the parents to say yes. 0 to 3, it's hard to tell. It's better if you get to the point where you need services and you're already on the waiver registry than if you're not. It's a tad quicker that way. And if you don't need it, then you don't need it. Good, happy dance. The transition to the MCAL Human Service Authority happens at age 3. If you haven't heard and or been contacted by them from age 3, you can call the Human Services, our Human Service Authority, and start the process with them. So to go into some of that a little bit deeper, the Office for Citizens with Developmental Disability Services and Programs, OCDD, serves as a single point of entry for a developmental disability service system. It oversees public and private residential services and other services for developmental disabilities. It's the state office. They used to call it use that term OCDD in the local office, but that's what the state office is called now. Our local office is the Imperial Calcasieu Human Service Authority. Every LDH region has one of those. It's a public funded agency providing developmental disability, addiction recovery, and mental health services. In our instance, it's Allen Calcasieu Cameron and Jeff Davis parishes, and Beauregard Parish. And you can go to the link. You're going to get a copy of this PowerPoint after the webinar. You're going to get a link and you can go to the Human Service Authority in your region if you're not from this region. And some of you may or may not have heard of Act 378 services or the Community and Family Support System. You might be familiar with some of the services included in the system, but not know how those Act 378 services originated. It actually originated from parents and self-advocates. So I'm going to share some of the history of Act 378 and the community and family support system, what services included, where we are today. The Louisiana system of supports for people with developmental disabilities has changed hugely since 1988. Before 1988, our state had few services for families who wanted their child with disabilities to grow up in their own homes. There were families or adults with severe disabilities who wanted to live on their own, but there basically weren't any supports for them to be able to do that. The only services that were available for people with disabilities were residential or facility-based. The state would build or establish a program and then put a person into it, whether it exactly fit their needs or not. The person would have to go to the program, or worse, live there in order to receive those services. At that time, we had 9 developmental centers, thousands and thousands of community homes, private institutions, and sheltered workshops. Let's see. In 1988, things started to change. The Louisiana Developmental Disabilities Council sponsored a conference on community integration. There were parents and professionals there. They heard about how other states were providing individual and family supports to children and adults with severe disabilities in their own homes. States like Michigan had a philosophy of whatever it takes to support a family of a child with a disability in order to keep their child at home, and that they would provide that to the family. In Colorado, they were supporting adults with severe disabilities to live in their own home. The presenters at that conference from other states inspired the people at the conference to think, why not here? If this can happen in other states, why can't we do this in Louisiana? At the end of the conference, participants were asked to dream about what they envisioned a perfect world would be for people with disabilities. People there said much of what they had heard from people at the conference, things like being able to keep their kids at home with family supports, individuals with disabilities living in their community as contributing valued members. All of those things were written on a flip chart and taped to the walls. But at the end of the session, when everybody was about to leave, a parent, Mike Vasco, he was from Shreveport, said, now that we have all these good ideas, what are we gonna do? Just leave them on the walls? Or are we gonna do something about it? The Louisiana Developmental Disabilities Council accepted that challenge, and the community and family support system was born. The council formed a steering committee of parents, self-advocates, and other advocacy groups that set its goal as creation of a community and family support system. This would be accomplished through legislation the next year. The steering committee held public forums around the state. They wanted to get input from stakeholders on the vision statements and to build support. And actually, that's when LeCan was born, through that community organizing. We started with one parent in an area and asked that parent if they knew another parent, and that parent might bring a friend, and so on and so on. Slowly, regional teams began to develop. I still get referrals as the CAN leader from other parents. The council also funded pilot programs in family support and supported living. This provided valuable information and data proving that people with severe disabilities could live successfully in their own homes and that it was cost effective in Louisiana. Act 78 passed, 378 passed in 1989. To this day, people from other states still say, how'd you do that? Louisiana was real forward thinking in 1989. It passed with unanimous legislative support. It called for a plan for a system of community and family supports for people with developmental disabilities. It also directed the DD Council to write the plan based on the guiding principles included in the Act. It also included an array of community and family supports to be made available to families and adults with disabilities. It directed the state to implement the plan for the council and for the council, the Louisiana Developmental Disabilities Council, to oversee the implementation. The Louisiana Developmental Disabilities Council formed an advisory group to assist in writing the plan. They held more public forums across the state to get input on what should be included. The process took 2 solid years. Then the legislature approved the plan and provided the first funding in 1991. The DD Council and LeCan have sought additional funding every year since then. There have been hundreds of millions of dollars annually appropriated to community and family support services. To this day, the Louisiana Developmental Disability Council continues to oversee implementation of Act 378. So, some of the waivers and programs through the MCAL Human Service Authority, the New Opportunities Waiver, the Children's Choice Waiver, the Supports Waiver, the Residential Options Waiver, Behavior Supports, the Flexible Family Fund. If you've been around a long time, like I have, you can remember when that was called cash subsidy. The Individual Family Support Program. Some people say IFS. Some people, if you've been around a long time like I have, will still use the term family subsidy, and residential services. So I talked about the guiding principles, and I want to go through the guiding principles. So several of these are going to be exact wordage that I'm going to read to you, and I'm going to talk more about the services included farther on. So one of the principles is that children, regardless of the severity of their disability, need families and enduring relationships with adults in a nurturing home environment, as well as with all children. Children with developmental disabilities need families and family relationships to develop to their fullest potential. Adults with developmental disabilities should be afforded the opportunity to make decisions for themselves and to live in typical homes and communities where they can exercise their full rights and responsibilities as citizens. Services to people with developmental disabilities should be responsive to the needs of individuals and their families rather than fitting people into existing programs. The family of each child with developmental disabilities shall be provided the support necessary so that the child may live in a stable family environment in an enduring relationship with one or more adults, regardless of the severity of the disability of the child or the degree of support necessary. Adults with developmental disabilities should receive the supports necessary to enable them to achieve their maximum potential through increased independence, productivity, and integration into the community. The family support system shall be flexible, individualized, and family-centered. The needs of the entire family shall be considered in the development of the individualized family support. The family support system recognizes that families are best able to determine their own needs rather than having their needs determined by a state or an agency. The system shall have a program of outreach so that families may obtain family support at the time they learn of their child's disability, and so that people are aware of the availability of community supports when the need arises. The system shall support and strengthen existing informal social networks and natural supports in addition to professional support and services. The system shall promote the use of existing community resources. So all of those guiding principles are so important. We need to hold the state accountable to this particular clause in the law. When they developed policy, when they implement the policy, when they make funding decisions, they need to adhere to those guiding principles. The phrase, whatever it takes for a child to remain at home with their family or for an adult to be in their own home in the community, isn't included in Act 378, but it's the philosophy the system was built upon and continues to be the foundation of the community and family support system today. So let's talk about results. Let's talk about what's happened in the system. Tens of thousands of people and families have received services in their own homes as a result of Act 378. There's been hundreds of millions of dollars appropriated and spent annually. Individual and family support, flexible family fund, consumer care resources. Consumer care resources is a term that's used in mental health. Adult supported living, families helping families, and waiver services are all included in the community and family support system plan. So those services are the individual and family support, the flexible family fund, and you see I have the notation afterwards. Individual and family support is in the developmental disability section. The flexible family fund is in the developmental disability section and the behavioral health section. Those consumer care resources that I talked about, mental health, is in the behavioral health section. Adult supported living, families helping families, waiver services for people with developmental disabilities. Those two things, the families helping families and the waivers were included in the community and family support system plan. Those, there's a committee they call the Act 378 committee that tracks all of the other things on this page, but those two things aren't tracked by the Act 378 committee. Those things are done by the entire Louisiana Developmental Disabilities Council. So the implementation or the administration of these services has shifted over the years. Initially, it was the state central offices. You know some of these things if you've been around a long time like I have. Now it's the OCDD and the Office of Behavioral Health Programs are through the LGEs, the Human Service Authorities, the Office of Aging and Adult Services, and the Developmental Disability Council also has programs. The Developmental Disability Council oversees the implementation. So the Louisiana Developmental Disability Council's role is to ensure that Act 378 programs are implemented according to the guiding principles included in the law and according to policy. The DD Council also participates in policy revision. The DD Council ensures Act 378 funds are spent and spent appropriately. They get reports. The Louisiana Developmental Disability Council advocates for additional funding and to protect against cuts. That's part of what we do every year. The Louisiana Developmental Disabilities Council assists in outreach and public education efforts. Let me check if there's questions. Nope, not any questions yet. You can put questions in the chat box if you have questions or you want additional information about something. Let's see. So some of the challenges with Act 378 is ensuring people with disabilities and their families have equal access to services. I'll talk a little bit more about that in a minute. Ensure the policies are implemented consistently across the state. Another challenge is ensuring that the Act 378 funds are spent appropriately. Definitely in years past, it doesn't seem to be that way this year, but we're still paying attention to the what's going on in the legislature, is to maintaining current funding and then to secure additional funding. That's part of the legislative agenda I talked about towards the beginning, the $2 an hour rate increase for the providers, and with the $8.65 an hour base rate or base pay for DSWs. And the Families Helping Families funding. So part of that challenge is that I talked about was there's sometimes a huge disparity. I'll narrowed it a little bit in the state general funding levels for the LGEs or the Human Service Authorities. From one section of the state to another, there seems to be a huge difference in the state funding levels. There's a disparity in funding of Act 378 programs across the state. So it matters where you live, what kind of services you can access, and it shouldn't. But some of the Human Service Authorities have a whole lot more than some of the others. So this is back into the section that I talked about where I would talk more about the different services. Our state has gone into a tiered waiver. Our state, there is no more waiting list the way that there was a waiting list years ago when I started doing this. And years ago when my daughter Domino got a waiver. Um, we're at the point now with the SUN. SUN stands for Screening of Urgency of Need, that with information that they get from the family, they're able to give children a level 0 through 4, and 4 is the most urgent, that anticipates how quickly families think or will need services. And using that, the state has figured out, God bless them, figured out a way to be able to offer a waiver slot to those families that are in urgent need. So actually 4s and 3s, I'm seeing it happen. 4s and 3s are getting a waiver slot, getting a waiver offered quickly. I don't mean tomorrow quickly, but I mean in a matter of a couple of months, 3 months. Whereas before this, you had to wait until your date came up on the waiver waiting list. So even if you were in dire need of help, sometimes you had to wait for years. Sometimes families hadn't heard of the waiver. Let's see, where am I? Children's Choice is providing services through the age of 21, not stopping at 18 like it did years ago. Children get a Children's Choice waiver unless there's lots of evidence that it can't meet their needs. The residential option waivers, that's the ROW, is an option for everyone now. At one point in time, it was just for people coming out of institutions. So let's say you have a SUN screening and your child is given a level, with your input, your child is given a level of 1. And for whatever reasons, things change dramatically. You can get rescreened. Your child can be rescreened through the MCAL stands for Imperial Calcasieu, by the way. Human Service Authority, Division of Developmental Disabilities, your LGE. They can hook you up to the process of getting rescreened. You can do that if you don't agree, but particularly if your situation changes dramatically, if your situation becomes more critical for whatever reason. That's to make sure people get this process. The use of the SUN screening and the levels is to make sure people get services they qualify for, and that they're not just sitting on a list and thinking nothing else is available. So what they do during that SUN screening is they tell you about all the things that they know about, which is a huge help to families. If you're getting Medicaid, you can get Epsdt, which has a type of service that can provide a person to help you, similar to the way one of the 4 waivers are able to provide a person that can help you. Sometimes people know about the waiver and they don't know about the Flexible Family Fund or the individual and family supports. And then we're still working on a TEFRA-like option in our state. At one point, they thought that was going to happen in January of 2021. Our state is waiting for the approval from the Center for Medicaid and Medicare Services. of our plan. They're not calling it TEFRA, but it's still going to provide a Medicaid card, which will be of huge help to some of our families. They need Medicaid as a secondary insurance. You know, they're working and they're drowning under medical bills. So the new opportunity waiver, the now, you can get help with that through the MCAL Human Service Authority. It's one of the things that you can do with the now is stay under the Louisiana Legacy Medicaid program. If you know a little bit about Medicaid, Medicaid has gone to a MCO arrangement where they contract with different agencies to provide the Medicaid services. But under the now, you can stay with the Legacy Medicaid program. That appears to be beneficial for a lot of people. Part of what you get under that now, since I'm talking about it, is Medicaid. Some of our families already have Medicaid because they're economically disadvantaged, and or because they get SSI for their child. Through the Now waiver, you get Medicaid regardless of your income. They waive your income so that even families have that as a secondary. There's also something done called a supports intensity scale under the New Opportunities Waiver. So the easiest way to understand that is some people need a lot of help and some people don't need so much help and some people need a little help. So the supports intensity scale, once you have a Now waiver, helps figure out how much help you need. You can do the Now waiver through an agency, provider, you can use those terms interchangeably, or self-direction. Self-direction means basically you, with help, select, hire, and train your own staff. Self-direction works really well for some people, and using an agency or a provider works really well for other people. You can get a personal care attendant. There's different terms. Direct support worker is the term I hear now, as well as nursing services. There's also a way to get adaptations or modifications to a home and vehicle, and there's pretty specific rules around that, what you have to do before, what you have to do during. So you need to be working really closely with your service coordinator and probably the MCAL Human Service Authority. Let me check for questions. Nope. Wallace is chatting everybody up with information though. Let's see. So the Children's Choice, again, you can get assistance getting there through the MCAL Human Service Authority. It's an option offer to pay families on the waiver registry. Families that accept the Children's Choice will remain on Children's Choice until their child turns 21, and they're somewhere right before they turn 21. They're reevaluated as to what waiver will best suit their needs. There's 3 other waivers. It could be any one of the 3. I believe the cap is still $16,410 a year. If anybody knows a better number, let me know. You can do agency or self-direction again. So you can do it with a provider or you can do it yourself again. You know, by yourself. When I'm talking about a child, I'm talking about a family. And even an adult may need assistance to do it themselves. It pays for non-traditional therapies and family training. That's a little known fact about Children's Choice. It also can pay for adaptations to home and vehicles. And it can be used in conjunction with the Epsdt. Remember, I said a little while back that there's a small program in Epsdt that can provide a person that's like a DSW that can do some very specific tasks. Well, when you have Children's Choice, you can access that program as well. Adults can't because Epsdt is for children. But that's a hard cap, that's 16,410. There are a few wrinkles to this that you can call me about because of things going on because of the COVID pandemic. But these things are generally still true even now. The supports waiver is for people 18 years and older with a developmental delay. You don't get this waiver if you have other waivers. You don't get the other waivers if you have this waiver. You get one of the 4 waivers. You could be receiving Epsdt because that particular program is up to age 21. Then at 21, that stops, and sometimes there's less services there for various reasons. The support waiver pays for day habilitation. Day habilitation is huge for some families. They can typically whoever provides the day habilitation provides transportation. So similar to like when they're in school, kids can stay in school until they're 21 if they haven't gotten a diploma and if they have a disability. But if they exit and they want day habilitation, a bus comes and they go to a site where they participate in activities that that prepares them for work and for taking care of themselves, and brings them home, similar to the way they caught a bus and went to school and came home. For young adults over 18 and for older adults, that's huge for a lot of families. There's also up to 8 hours a month of that direct support worker services that I had talked about. Let's see, more things in the chat. So, will the slides be emailed? Yes. That's my plan, or our plan. Somebody else said, I dislike going through companies that employ the workers. The quality of care is horrible. I feel like I'm still doing all the work for my children. You might want to call one of our office and talk to somebody about the program that you're in and whether you can do self-direction. I believe some of the families that I've spoke to that do self-direction have mentioned that that has worked well for them. Good questions. Let's see. The residential options waiver. So that is birth through the end of life for a person with a developmental disability prior to the age of 22. That's actually true for all of the waivers, by the way. It was designed, the row was designed to support the move from ICFDDs, institutions, hospitals, or nursing facilities. But now it's an option for anyone on the registry. You can use a provider or you can go do self-direction. If it's somebody that's in the institution, there's one-time transition services. That's not typically something that someone needs that's living in the community. Assistive technology, specialized medical equipment and supplies are part of this waiver. That you'll still be given that level that determines how many hours of direct support worker services that you'll receive. Let me check the chat real quick. So somebody is in the chat is mentioning that hopefully our state will get to keep some of the changes that have been made for the pandemic. There are several groups in the state that are working on that, as well as the state, by the way, that allows family members, responsible family members, to continue to work as the direct support worker. And I think there's another one that allows the direct support worker and the person with the developmental disability to live in the same home. There's a list of them. If you need to talk about more, again, you can call us and talk about it more at the office. But yeah, those are great things that the state did during the COVID pandemic that families would like to keep. And it mixed up my letters for the MCAL. It says MCAL has, and it should be MCAL HSA, MCAL Human Service Authority. My computer doesn't like it. So family support, the individual and family support funds. What is that? That's a separate pot of money that families can request some financial assistance to help care for their family member. So a lot of families don't have a safety net. They don't have anybody that they can return to when something happens and they need help. They are working reduced amounts or sometimes not working at all to care for their family member. And there needed to be some kind of safety net. And that was what this was developed for. You need to request this separately from your waiver request. If you have a child that has EPSDT, you have a person called a service coordinator. Your service coordinator can help you with that, or you can call the MCAL Human Service Authority directly yourself. If you don't have the support coordinator, the service coordinator, like you don't have a waiver yet and your child is over 21 and doesn't have Medicaid. Some of the things that it can pay for is respite, the direct service worker, therapy, medical supplies, maybe dietary supplements. And these are things that Medicaid wouldn't pay for. So there is a process in there, some equipment, some home modifications, dental, although there's a bill being offered, and I'm sorry, I don't remember who right now, about dental care, because our people with developmental disabilities sometimes have some very specific needs around that. Let me check the chat box again. Yep, it's awesome. I agree. A lot of help to families. Somebody is telling me if someone has a request that could possibly be met with the individual and family support funds, the contact person is Tammy Lewis, and her number is 1-337-475-4830. Let me write that down. 4830. So as I'm sure everybody knows, if you're in our area, is the building that the MCAL Human Service Authority was in, the I think the last thing they called it was the Capital One Tower, was slammed. I don't know what else to say. They've had to work from home. They've been working. They've had to work from home. They have some of them in various offices in various places. If you call a number that we're giving you and it doesn't work, call us. We'll find another number until we find something that works. I think I know it was someone from the Human Service Authority that provided that number for Tammy Lewis. Again, 337-475-4830. Okay, let me move on a little bit. The Flexible Family Fund provides financial assistance to families whose children qualify. So that's something that's important to know. This is for children. There is movement on the list, the waiting list, if you will, for this service, because this is about children. So as children age out, a slot comes open and they look at their list to see who else that they can work with, that they can provide help to, that the Human Service Authority can provide help to. It's a separate application process. It's a very specific process. When you apply for services, they're going to tell you what that process is and exactly what to do to get on that waiting list. The kids have to be under 18. It's $258 per month to be spent on the child's needs. So you could spend it on any of the things that I talked about for the individual and family supports, and keep your receipts. But you have to qualify. You have to have a qualifying exceptionality. The qualifying is tighter for this particular service. So I don't even expect all of the children that are on the waiver registry would qualify for this service. If you wanted to apply for individual and family supports, you qualify Tammy, you would call Tammy Lewis. I'm reading from the chat. If you wanted to apply for the Flexible Family Fund, you can ask your service coordinator to help you, or you can call the regular line for the Flexible Family Fund. Positive behavioral supports. So some of people with developmental disabilities need intensive support to remain in the community. The positive behavioral supports are provided by a team of professionals. They provide help in the home, in the community setting. So it's not necessarily something that you go like counseling to somebody's office, though you might get help like that in this manner, but it's meant to be intensive and specifically to for people with developmental disabilities. Again, you see that phone number, you can call that phone number, you can call that phone number for this, and you can call that phone number for the Flexible Family Fund. The name wouldn't come. Somebody's asking about horseback riding. I don't know of utilizing the waiver for painting. For horseback riding, if you look on our website under resources, there is something called a resource list. You go down the resource list and look for therapies, it might be under autism services or therapies, one of the two. You're going to see the company in our area that does the horseback riding therapy. They're going to lead you through the process of using Medicaid to get that. I guess I'm assuming you have Medicaid. If not, you can call us. Statistical resources. I include this in here so I can talk about, don't ignore those letters. When you get a letter from statistical resources, that's an important letter. When you get a letter from OCDD, that's an important letter. When you get a letter from the Human Service Authority, that's an important letter. They have to know where you are to be able to help you. And one of the ways when they can't, maybe it's the first way, maybe it's the second way, but one of the ways when they're concerned about keeping in contact with you that they do that is they send a letter. If you see a letter that says statistical resources, don't throw it out, read it. Something's in it that you have to mail it back, but keep a copy. I would mail it certified mail, just because I want to have a record that I did it. We have a whole workshop devoted towards record keeping and how important that is. But you need to pay attention to the things that the things that you're getting from those entities in the mail. I see somebody says Children's Choice Waiver covered horse therapy and art therapy. And maybe art therapy is just something I don't know about. I'm sure there's lots of things I don't know about. Self-direction. To talk to those of you interested in that a little bit more about it, basically you become the employer. You're responsible for the hiring, the firing, employees turning in their timesheets correctly and on time. You'll actually approve those. You keep track of hours. You're supposed to keep a record of daily activities and duties. It's no walk in the park. On the other hand, it's something you can do and something that some families are very interested and motivated to do because, well, because you're not using a provider, there's more money available to be able to pay the worker if you choose. But you don't have to worry about handling the money. A fiscal agent takes care of the money and paying the employees, assuming that the timesheets are turned in and they're turned in correctly and on time and you've approved them. And you know what? If you don't like it, you can go back to using a provider. There's pros and cons. There are Facebook groups devoted to this that can talk to you about the Facebook, Louisiana Facebook groups that can talk to you and people that can talk to you about the pros and cons. It's an option. Let me check the chat box real quick. Great questions. Wallace is providing y'all more information. So the Epsdt Medicaid, Epsdt is a Medicaid service. It's not a waiver. It's ages birth all the way through the year that they're 20 years old. One of the things that you can get is personal care services, similar to a direct support worker. You can also get nursing services. Epsdt is designed specifically to meet a child's medical need, and there's very specific rules around it. There's a timeline. You can use it in conjunction with the Children's Choice and the supports waiver as long as the person is still under age 21. When they're you can have a supports waiver after 21, but you're not going to get these services, these EPSDT services. So long-term personal care services, it's through the Office of Aging and Adult Services. Again, it's not a waiver. This is for people 21 or older. They have to be Medicaid eligible. This specifically helps with activities of daily living at home. There's limited hours to this. This is useful to people that don't have or don't need one of the 4 waivers. There's limited hours, and it's specifically for those activities of daily living in the home. You apply by going to the Office of Aging and Adult Services. You can contact us if you need any more help. So waiting, like I said, there really isn't a waiting list anymore. If you need help and you need help quickly, there's a way to ask for help quicker through the SUN screening. There's a way to get help, a few ways to get help, even if you don't have a waiver yet. Call us, talk to us about it. That's what we're there to do. The EPSDT PCS services are through your, remember I talked about Medicaid went to a MCO, managed care option. That those, I think there's 4, maybe 5 agencies that Medicaid contracts with. You go to your plan and you ask them about it. The long-term care PCS, age 21 and over, that's the Office of Aging and Adult Services. Family Opportunity Act. Some families need Medicaid, and they're able to get Medicaid. They're able to, quote, buy into Medicaid for sometimes really small fees if they're within a certain income range over what they might need to be for Medicaid or for SSI, but under the requirements for the Family Opportunity Act. If you need to apply for that, you probably want to call us and talk it through. I'm already running close to a little over the time that I plan to speak, so I don't want to overwhelm you. Incontinence Supplies, diapers, age 4 through 21, you can get that through Medicaid. Transportation provider, you go to your MCO plan, you go to your Medicaid plan. You can find a number and ask for a special needs manager by calling the number on the back of your plan card. Friends and family transportation, that's, again, you call the number on the back of that MCO, that provider card, and you tell them that you have friends and family that will help you get your child to doctor's appointments, etc., and how can you get reimbursed. It's not a lot, but reimbursed for gas and to take them back and forth, especially out of region. Let me check the chat box again. So someone is saying that their child is a child and has been on that now for a few years now. And when he turns 21, will the hours go up? There's a lot of factors that figure into that. More factors that I can probably go into on this webinar. Like I said, feel free to call us. And, you know, we can have a discussion about the type of therapy that he's getting and school-related things or not school-related things as well. More chatting. Somebody sharing you need to request more hours to your coordinator. So if you want everybody else on your on this to see what you're saying, you have to go to where it says all panelists and click all panelists and attendees. I'm more than happy to read some of these things if you don't want people to see your name, but I also want to bring it to your attention that they don't see what you say unless you're saying it's saying that you're going to all panelists and attendees. Let's see. So what can you do? What can you do to make a difference? What can you do to have your say? I don't know why this says Region 2. It should say Region 5. I'm so sorry. But you can join LACAN. There's the website again. Your Region 5 LACAN leader is Melinda Elliott. You can get on the Families Helping Families mailing list. We have an awesome newsletter that goes out every quarter. There's information in the newsletter about what we're doing, what we know about. You can go to our website. We have lots of training, especially around education, that you can, webinars that you can register and participate for on our website. And advocate. If you sign up to get those LACAN alerts, make your views known. And speak to your legislators and your BESI board members about things that work and things that don't work for you. That's advocating. Your story, that's advocating. So OCDD services, there's also a group called the Regional Advisory Committee. They are always looking for particularly individuals with disabilities and family members to participate. They meet every quarter virtually right now because of the COVID pandemic. You can call this number. The lady that can help you is Donnie Perry. She's the NCAL Human Service Authority contact for those regional advisory committees. If you're on that committee, there's a group of people on those, every region has one, on every regional advisory committee that's on the state advisory committee. They also meet every quarter. You don't have to be on the state advisory committee to be added to their email list and to be kept informed. You just have to let me know. You'll get invitation to the meeting because we can do that virtually. And you will get the minutes and know how and what is going on. Let me check the chat again. So let's see. Okay, thank you. The PowerPoint was originally created in Region 2 by Kay Lewis. I've added some hoots and whistles to it. So yeah, probably half of the PowerPoint. I need to figure out how to put that on here somewhere. Oh, where? Thank you, Kay. Let's see. I'm representing Louisiana with 0 to 3 for Think Baby Stroll Thunder next month in Washington. I'm advocating for my baby and also advocating how important supports are for people with disabilities to have support and how that plays a role in baby's development. Oh, great. That's wonderful. Thank you. Let's see. If you haven't signed your child up for services, or if your circumstances have changed, call the MCAL Human Service Authority. There's also the number for Statistical Resources Registry. You need to remember, Family Flexible Fund is one of those ones that's going to send you a letter every year. You need to answer that letter. And then ultimately, you're responsible for informing all the agencies of any change in address or phone numbers. So to summarize, hopefully you have a good understanding about waivers and services, the different waivers and services during different parts of a person's life. You can call Families Helping Families of Southwest Louisiana at 337-436-2570. You can email us at info@FHFSWLA.org. We have an awesome Facebook page, a Twitter page. You can look at our website for trainings, get on our newsletter. There's lots of things that you can do to stay involved. Are there any other questions? I know Wallace has it set up so that you are going to get the link for the evaluation as soon as you leave the webinar. There's also a link in the chat box. And if you miss it, either of those two ways, it'll be in an email. Please, on our evaluation, if you know other things you want to see a webinar about, let us know. If you if you have something to say, let us know, because we take those evaluations seriously. Let's see, funding for the workshop, Families Helping Families, Southwest Louisiana, LaCan. I'm not seeing any questions in the chat box. I appreciate y'all attending. I'm going to hang out for a few minutes to answer questions. If you need me to, just put it in the chat box.